become important. So these sheets are good because they're soft, but they're too big. When you start to drape, the bigger the sheets are, the more challenging it is because you've got a lot of excess material. So just keep that in mind, that at some point in time you're going to want to buy more specific massage sheets. So first thing we're going to learn to do is drape the leg in a prone position. Okay, so we'll spend time and we'll practice this. So to begin with, I take up some of the slack. You see, I just bring the sheets so they're a little bit on the table. I get all the slack out. So there's nothing bunched up here in the middle. If we need to, I can take some more slack out of here. We need to make sure that there's no extra material, okay? And then I'll uncover the lower leg up to the knee. I will bend the knee. With my inside hand, I'll grip on the knee. With my outside hand, I'll roll under, grab the sheet close to the knee, underneath, and pull up towards the head, okay? Then we can relax that leg on top of the sheets.
Ah, cool.
Just like that, okay? Now, what we do here is if you have a towel, it makes life much easier. You just put a towel over top. If not, then we'll just wrap underneath the underpants. We'll roll up just a little bit, and we'll go underneath the hip. So I'm just going to move this under your hip right. That's great. You can relax. Good. Now this is a very functional low drape. During relaxation massage, this is all we need to do. We don't need to drape any higher. You certainly can, and we will when we get into therapeutic massage, but since we're just doing relaxation, this is all we need. So now we can work on the glutes all the way down the posterior leg. Yeah?
Mm-hmm.
We'll start with the glutes. So within the glutes, I'll stand on the side of the table, and I'm going to be, the first thing we do, of course, is it all right if I work on your glutes? Yeah. Ask permission. Regardless if you started on the back or on the leg, before working on the glutes, ask permission. Okay? So, as I work on the glutes, I'll always start with a loose fist. In fact, I prefer to use my knuckles more than anything else. And this is just basic kneading. Notice we didn't do any stroking techniques. I don't want to rub her bum. So I'm just going to start in with the kneading techniques. I'm using the broad side of my knuckles. I'm not using my fingers. I'm using the broad side of my knuckles with a loose fist. And I'm working the entire glute. So starting at the sacrum, nice and easy, moving lateral. Very light pressure, using almost no pressure at all. You doing okay?
Yeah.
Yeah.
I want to see.
Oh, go for it. and I can spend a minute or two just doing this basic kneading technique. It's nice and easy, right? But what I can do also, after I've done this more superficial technique, is I can use my fingertips. I'll find the sacrum, and we know the insertion is along the sacrum, so I'll just push into the sacrum, do these tiny little circles. That's nice and easy, hey? You okay? No pain? And I can pay attention to trigger points, but as I mentioned before, when it comes to doing any type of deeper work, that's not going to fit into relaxation. It's hard to do deeper work on the glutes and maintain relaxation. Really what I'm looking for is to get that glute max to relax as much as possible. So those are my circular frictions all along the origin of the glute max. I could do a little bit more kneading. Yeah. It goes all the way up like that.
Lumbar.
Yeah. Not into lumbar, not lumbar.
Crest.
Lumbar here.
Yeah, exactly. That's iliac crest, so it's below.
Oh.
If I need to use a little bit more pressure, I don't think so in this case, but just in case you're working on your partner needed to, I'm not going to use my fingertips. I'm definitely not going to use my thumb. What I'm going to do instead, nice and easy, apply my forearm. So as I do so, I'm standing in a nice low lunge position. My entire forearm is resting on the glutes. My ulna will press into the sacrum so I can feel the sacrum with my ulna, yeah? And I move just a little bit away, and now I lean in and apply pressure. How's that pressure? Is that okay?
Okay.
Yeah? Do you need any more pressure?
Little.
A little bit? So if I wanted to put more pressure in, I can really lean. That's going to hurt my shoulder. So instead, how's that? I just lift my arm slightly, barely lift my arm at all. And now I can do tiny little circles. You doing okay? Yeah. I can lift up, move superior, find another spot, apply pressure, bend my arm. Yeah? So within this, what's important is is if I use my knuckles, you tell me when there's too much pressure, okay? That's all I got. I cannot put more pressure in. I'm done. With my elbow. You tell me when it's too much pressure, okay?
Okay.
Okay. Took almost no energy at all. So it's hard to get the depth with your knuckles. It's easy to go too deep with your elbow. So be very slow. I do not want to see this. It's this. It's nice and easy, right? Because we're relaxing. We want the nervous system to calm down, okay? So that's how you do it, but there's other things I do not want to see you do. I don't want to see any broad hand, okay? It's your knuckles, elbow, your fingertips, all right? If you're going to do any stroking technique, you'll stand a little bit further back and you move towards the midline. Never away from the midline, okay? That's it for the glutes. We'll keep it nice and simple. Just a couple techniques. Nice, slow, gentle. Now let's move down into the leg. So since I was working on the glutes, my draping has undone a little bit. That's no problem. I'll just tighten it up again. Okay? Good. Now I'm going to put a little bit of lotion on. You know the rules. Start with a little bit and add more if you need to. I'm going to put lotion on the entire posterior aspect of the leg. Because I'll be working on all of the leg. And there's different ways you can go about doing this. It's totally up to you. What I prefer to do is work here, then all of the leg. That's my preference. I find it works really well. So we begin with effleurage. As we know, effleurage is nice, broad, gentle strokes, not applying any pressure at all. What you'll notice is I get down here, I kind of do some ringing once in a while, and I can ring all the way up the leg. So this is all very superficial petrissage techniques. I can do pickups. So it is really like we're trying to pick the muscle up, right? As you do this technique, if you are finding it's hard on your body, if you're squeezing, you're trying too hard. It's like simple. You're not squeezing too hard at all. It's a superficial technique. Now, this hand, so moving up the adductors, there's the sheets. I never, ever, ever, ever go under the sheets. Once I get to those sheets, my hand moves out. Okay, that's it. So, I know the way that we talk about it is you do effleurage and then you do petrissage. But no, I combine them. A bit of effleurage, a little bit of petrissage, different types of petrissage techniques, right? And the idea is to keep it nice and smooth until I start to get into my deeper techniques, because now I'm going to do muscle stripping off the hamstrings. I prefer to start distal and move proximal. So long as your client does not have any significant swelling or edema in the ankle, you can go the other direction. So it's up to you. I prefer distal to proximal. So I'll show you a few different ways to go about it. I'll start just above the popliteal crease. I'll use the palm of my hand. Once I get above that popliteal crease, stack my joints, take a breath, and I start to lower my pressure in. How's that pressure? Is that okay? Yeah, good. Move up nice and slow. As I get up towards the glutes, I turn my arm out, I follow through with the stroke. And I come back down. If I were to start from superior and work inferior, same thing. Stack my joints, nice healthy body mechanics. I move nice and slow and easy, right? So that's how we can use the palm of our hand in either direction, which is great, nice and easy. Another way we can do it is I can use a nice loose open fist. So I just apply my fist, see it's open, right? I'm not closing, I'm not making a fist and pushing like this, it's relaxed. With a relaxed fist, I put my body weight into the hamstrings, and once I've reached the depth that I want, I just lean back a little bit and my hand will naturally start to move up the hamstrings. Nice and easy. That feels good on my body, right? There's no tension anywhere. Shoulders relaxed, chest is pretty relaxed. It's not requiring much energy at all. As I get up towards the glutes, the ischial tuberosity, I just lighten up, move out, follow through and come back down. With me so far?
Yes.
Great. Let's say your client wants a little bit more pressure. With my forearm, not my elbow. My forearm, I do the same thing. I engage the tissue, I get to the depth I want. Once I'm at the depth and pressure I want, I slowly start to move up. And all of this pressure is coming from my core and my body. How's that pressure? Is that okay? Yeah. Okay. Once I get up towards the hips, I can lighten up and come back down. I could do the exact same thing from the other direction, right? If I wanted to, certainly. Now once I get to that popliteal crease, I lighten up. I don't want to go deep over the popliteal crease. So far, so good, making sense? So some muscle stripping. Now what I want to show you is I move quick so I can show you how to do the techniques. I really want to emphasize speed today. So when I'm working on the leg, I'm now going to show you the speed that I practice in clinic when I'm treating a patient, okay? So I can use the palm of my hand, engage the tissue. I'm going to move a little bit deeper now. You tell me if the pressure is too much, okay? All right, now this is the speed I go. Looks like I'm not moving at all, doesn't it? It's so boring watching me do this, but I really want to emphasize the fact that going slow, really, really slow. Feels good. Do you feel okay? How's the pressure? Good. Okay. I'm going to continue this pace all the way up. In fact, now what I'm starting to feel, because I'm going so slow, is I feel some tension that I didn't feel before. I was moving too quick. I feel tension in biceps femoris. And if I wanted to, I could spend some more time right here. I'm not going to, though, because the interesting thing is that going this slow has a deeply therapeutic effect as well as relaxing. Pressure still okay? Yeah, better there? Yeah, good. And as I move up, you see I externally rotate, and now I can lighten up my pressure, finish the stroke, and come back down. Maybe you find you don't have the strength to do that with your palm, fine. Use your knuckle, do the same thing. You can go deadly slow. Maybe I support my wrist as I do this. I'm moving, doesn't look like it, but I am. Maybe use your elbow. I don't care which contact surface you use, I really want to see you move slow, okay? Now after you've done a few strips up and down nice and slow, you can go back into your stroking techniques. We could do some pickups and some ringing, right? We could even do some grasping techniques. Let those hamstrings roll underneath our fingers. Light pressure, right? I'm gonna move down here to the leg. Okay, so the leg is the exact same idea, right? So I've already done a fairly general massage of the leg, or effleurage as I applied the lotion. I can do some squeezing, right? Squeeze that medial head of the gastroc, get into that soleus, or some grasping technique rather. And I'm being quite gentle. What you find is if you squeeze too hard, foot will cramp up. The toes never lie. Watch the toes. They'll tell you if you're using too much pressure. I can do my ringing techniques, all the same things, right? And then once I start to get into the deeper pressure, actually what's preferable is to have a bolster. So if you'd like to today, you can wrap up your pants or something like that because we don't have bolsters right now. But give your client a bolster. You do want their feet or ankles to be up off the table, okay? So instead, I'm just going to hold here. Again, a bolster is much better. I'm going to engage that tissue and make sure my joints are stacked. Nice and easy. How's that feeling? Okay? Not too much? Good. And I'll move up. Nice and slow. Going a little bit faster now. That's okay. Get the idea? So what you've seen now, after making it all the way through the body, massage is not complicated. It's not technically difficult. Practically, though, it takes a long time to get good at this. To be able to move slow and monitor your pressure and maintain consistent pressure and really feel what's going on. So the basic techniques you've learned, I really want you to start to play around with them and get good at doing them. Part of the way we do that is going slow. So then after I've done a few of those, I'm not going to make you watch the whole stroke a bunch of times. Again, I could use my knuckles, I could use my forearm, I could go the other direction. It's all good, whatever you feel. And then I'll do a nice long stroke through the entire posterior leg. Do a couple quick ones, and then to finish off, I might do one medium speed, maybe like this. As I get towards that popliteal crease, doesn't matter if I'm using, say, knuckles, I get towards that popliteal crease, I lighten up my pressure. Once you get over the crease, I sink back in. Yeah? Making sense? Okay. Now I'll show you how to undrape the leg. So these ending strokes I'm doing, it's again superficial, deep. I'm going superficial. Okay. Bring the knee out. Grab here, unroll. Take the sheets from under there. Pull. And we're good. Okay. Wonderful. Give that a try.